Now, October is Breast Cancer Awareness Month, a time to remind the world that early detection saves lives. In Nigeria, thousands of women continue to battle breast cancer, often facing late diagnosis, high medical costs, and limited access to care. Many still struggle in silence, especially in rural areas where screening centers are scarce. Health advocates are urging regular self-exams and more government support to make treatment more affordable. This month is more than awareness. It's a call for action, compassion, and stronger healthcare systems for every Nigerian woman fighting breast cancer. Well, for more on a Breast Cancer Awareness Month, we're joined in the studio by Dr. Gabriel, Clinical Director of Oncology at the African Medical Center of Excellence. Welcome to the show, sir. Let me begin by asking, could you start by explaining what breast cancer actually is and why raising awareness is particularly important in the Nigerian context?
Yeah, thank you so much for having me, and it's a really important question. So breast cancer is an abnormal growth of some cells in the glandular tissue of the breast of females, most commonly, and some males. Screening why it is important because for four major reasons. Number one, unfortunately, breast cancer is asymptomatic, totally silent, at very early stages. Number two, breast cancer have no characteristic symptoms. So if any female or some males have a breast lump, it may be any other things, not only breast cancer. Number three is our tools by today's standards is truly capable to help those with early stages to be cured, but it is not totally effective in later stages. Number four is breast cancer, if we need to treat early, the intensity of treatment will be much less if the patient presented lately. So my recommendation and advice, we need to move forward to get our fears behind our back and go to have the chance to discover, if anything, as early as we can.
So now there are 32,000 cases of breast cancer in Nigeria now, according to findings. What are you doing to make breast cancer treatment more affordable and accessible to those suffering from this disease?
Wonderful question. So, particularly in the Nigerian context, I think the major problem is not the money. So when we talk about access and affordability, the word money jump into our brains because breast cancer treatment is so expensive. But let me give you a very nice statistic. If you treat breast cancer patient early enough, stage 1 and 2, the lady may only need surgery and we can save her chemotherapy, radiotherapy, and mastectomy. So if you are talking in terms of money, breast cancer early detection will save the family too much money and will give you an extra years of life to those who are afflicted. This is number one. Number two, it is not only about money, it's about the access to the right technology and the right time to have the experts in the field available for those patients. So at AMCE, we are trying to do the best to offer the best technology, the well-trained manpower, and the early detection capabilities so you can cut a lot of the cost if you let the woman came with a stage 3 and 4 where a lot of money needs to be spent.
Now, Dr. Gabriel, you spoke about the fact that there are almost no symptoms to detect what is going on. And this is a bit worrying, I'm sure, for the viewers and for myself as a woman to know that something that's so dangerous can come without announcement. So what can I do, what can the viewers do to enhance their chances of early detection? Is there any lifestyle changes that women can probably make? And can you talk us through some of the ways that we can probably self-examine ourselves?
Thank you so much. It's a very brilliant question. So I am here just to give assurance, not to give a lot of fears. So early disease is silent. This is the biology of the disease. It's nobody's fault. So what we need to do is according to the recent guidelines, each and every female from 40 years and more, and those are younger with family history, she needs to go at least once per year to her oncologist for clinical examination and to do something called mammography, which is a sample scan to the breast to show if there is any abnormal things in. You touched a very important point regarding breast self-examination. So for each female, you need to know and understand the shape and consistency of your breast. So every month, and the second or third day after the regular menses, you need to examine your breast. At AMC, we have a lot of small booklets, some educational videos we can share, how to do a breast self-exam, just to understand your breast anatomy. So if any abnormal thing appeared, you can go and ask your physician. But my advice is clinical examination alone and self-breast exam alone is not enough, because nobody can detect 0.5 centimeter mass. So we need to go once a year to your oncologist to do your screening mammography.
So now let's assess the level of federal government support and also across subnational levels. How would you describe this support? They've announced the construction of 6 oncology centers and also proposing a radiotherapy treatment of 400,000 naira as an insurance health security support. Yeah. How would you describe this? Is it enough? Because we have a mortality rate of 20% and also the 32,000 cases in the country.
Yeah, thank you for that. So I commend the efforts the government is currently doing. Nigeria is more than 200 million inhabitants. The 50% of the population, I think, will be females. So the expected incidence of breast cancer will be a little bit economically something big. So to have a federal government that plans to initiate and construct more high quality cancer centers, I commend this move, and I think this will add to the private sector. So you will have this collaboration between publics and private in the term of to increase the space for patients to go, also the access to cutting edge radiotherapy techniques.
Now, we spoke about early detection and how women can self-assess, but what we haven't spoken about are patients who are in a more advanced stage and who are just finding out and who don't have enough information on breast cancer but probably have already received a diagnosis. What information can you give that is helpful for someone who is probably in an advanced stage, both, to them and maybe to their family members and loved ones who might want to support them?
Yeah, so my first clinical advice, the word advanced is a clinical word. It should be left to experts. So for each and every female that got to know she has a breast cancer diagnosis, please go to your oncologist. Don't wait. Try to challenge your fears and start discussing with your oncologist according to the plan of management. So I'll give you a little bit of good news. Nowadays, even some advanced breast cancer cases potentially curable, which means a very long-term survival. I'm repeating myself again. For some advanced breast cancer cases nowadays, we can offer a very good intervention that will give the lady a very long-term good outcome.
Okay, now when we look at the challenge of breast cancer treatment in Nigeria, we look at the rural areas that is faced with a lot of constraints like shortage of healthcare professionals, transport barrier, and also shortage of healthcare facilities. So what solution should we look at in addressing the breast cancer as it relates to rural areas?
Thank you so much. It's truly a brilliant question. We have two approaches. I'm talking about AMC now, that we have a lot of plans for outreach campaigns. So we have plans to go to some rural areas, just as you mentioned, to give some examination and to give some assurance to those families who are living so far from the center of the city. The other approach is, please, patient life and patient health is priority. So of any reason, you are so far for this outreach, please move. Please try to go to check yourself. It's a once per year activity.
Okay. Now, I'm going to ask you if you can just maybe talk us through in your seat how a woman can go about self-examining, because I believe that there's a method to doing it. It's not just as simple and as straightforward. I believe I've done a few of these examinations in past years, but to be honest, even from having done it before, I still can't remember if I'm even doing it correctly. Can you walk us through how it is that a woman can self-examine herself?
Yeah, I'm so happy with this meeting. You have a lot of clinical experience. So I'll play as if I'm a female. By the way, screening is for those females who do not have any symptoms. They are normal female. So suppose I'm trying to examine my left breast. We are seeing the breast as if it's like a watch. We have 4 quadrants, and we have a central quadrant, which is the areola and the nipple. So using your fingertips in the 3rd or 4th day of the menstrual cycle, more importantly, if you have some soap at your hand.
Oh, during the cycle?
Yeah, 3rd or 4th day,
see.
this will give the breast the tenderness of the menstrual cycle a little bit will disappear. For some females, they cannot tolerate any touch during the cycle, so it may have it the 3rd or 4th day after finishing her menstrual cycle. So what you need to do is using the fingertip, putting the fingertip at the upper outer quadrant, then try to move your hand to examine the breast against the reps. So it's a circular, soft movement, trying to elicit any nodularity, any abnormality. This is in terms of palpation. Before doing so, in front of your mirror at the washing room, you need to look to your both breasts like this. I'm looking to the shape, to the symmetry, to equality of both breasts. Then we ask you to raise both your upper limbs up and trying to see if there is any asymmetry appears during the movement. So it's 2 major ways to examine your breast: inspecting your breast in front of the mirror and trying to palpate the breast in 5 quadrants against the chest wall. As easy and simple, but please be cautious not to have a trauma to yourself, as soft as you can.
Okay, now let's look at evidence-based medicine now. Thank you very much for that illustration, by the way. Now, do you think there's enough funding to support research on breast cancer along the line of evidence-based medicine
Yeah,
in Nigeria?
thank you. So evidence-based medicine is the major value of evidence-based medicine is to give the best available treatment for the least cost. This is the value of evidence-based. What means by evidence-based is no one should go for an advice or recommendation away from the consensus of the scientists. According to AMCE charter, we are going to have a robust clinical research program in our hospital, inviting a lot of the pharma industry in the field, inviting a lot of the world-renowned scientists. I met a lot and I talked to a lot of our brilliant Nigerian oncologists in different universities in the country. They have already some small-scale research and very wonderful publications in a high-quality clinical journal. So I think Nigeria already started, but I think we need more to come. And the AMCE value here is to offer a clinically and contextually relevant research. It's not only academia, but how can we help our people in this country?
Right, that's a very interesting comment, which leads me to my next question. In your experience, what are the main and the biggest barriers in, this working in this type of context, the context of Nigeria? What are the challenges that are faced and the areas where you might need help and assistance?
Yeah, so I think the number one enemy, not only barrier, is fear. So we are now talking about normal females that need to go to do some screening to be assured or to discover a disease as early that may surgery alone help the patient to be cured. So fear and cultural stigma, I think, one of the major barriers against some females to go to see their oncologist. Number two, I think It is the reputation of chemotherapy and surgery, because too much of surgeries was mastectomies, too much of chemotherapy was highly toxic. So, according to my experience over the last year in this context, fear and the bad reputation of some of the treatments make the patient reluctant to go to the oncologist. My message today is breast cancer management is totally changed over the last 10 years. Some females, we can omit chemotherapy. Too many females nowadays, we do not go for mastectomy.
Yeah, just before we go, because we're pressed for time. Now, looking at breast cancer in Nigeria, what are your projections? Is it likely? Are the cases likely to diminish? If it's likely to rise, what should we be doing as a matter of urgency to curb the rate of breast cancer in Nigeria quickly?
So the major outcome to discuss is not the incidence, it's the mortality rate. So unfortunately, all over the world nowadays, we have a lot of statistics talking about increasing incidence of breast cancer, and especially in younger age population. Africans have a more susceptibility to get breast cancer. So to cut the incidence, it's a huge project and it needs a lot of time. But my advice today is we need to impact the outcome. Irrespective of the diagnosis, we need to be cured.
Okay, thank you very much, Dr. Gabriel, for that wonderful illustration and insight into breast cancer in Nigeria. Thank you very much indeed for joining us live on Daybreak on Arise News. Thank you very much.
Thank you so much, sir. Thank you so much, man.
Well, and that's all we have time for here on Daybreak. It's goodbye from me, Benga Ashuru.
Please do keep it here on Arise News. The morning show is next. My name is Yolanda Robert. Goodbye.